Hello, everyone, and thank you for joining today's session, which is on restoring your pelvic floor. My name is Dolores, and I'm one of the support services officers, part of the support services team at Ovacome, just in case I haven't met some of you before. We're joined by Sarah Russell, who will lead the class today. And just a reminder that you do need to be at least 6 weeks post-surgery to take part in the session. So that's it from me. I will pass over to Sarah and enjoy your class today.
There you go. I think I can do that. Right. Okay. Hi, everyone. Good to see you all. I'm just going to pop my some slides up so you get a little break from it. We're not going straight into practical stuff straight away. All right. I'm hoping that you can all see some slides. My computer's just a bit slow. Right, there we go. Okay, so welcome. I'm going to spend about 20 minutes just going through some theory and some slides, and then we're going to do a little bit of a practical workshop. So I'm Sarah Russell. I know some of you from the exercise class we do on a Tuesday. For those of you who don't know me, I'm a clinical exercise physiologist, not a physiotherapist, slightly different. I'm a clinical Pilates teacher and a cancer exercise specialist. I have also had 5 abdominal surgeries myself, not from ovarian cancer, but from for a bowel condition, which has led to me living with a permanent colostomy bag. So this has really got me into a deep dive and a real sort of hyper focus on the role of the abdominal muscles around exercise, rehabilitation, hernias, prolapses, all the things that we deal with, and how important it is to restore our strength and our confidence in our abdominals and our pelvic floor area. So let's just go through a few bits of anatomy. So the pelvic floor is a group of muscles, lots of little muscles that all come together to make a group. And it's a sling that sits at the bottom of our pelvis. And you can see there the image on the right. The pelvic floor, it's like a sort of hammock. And it comes from the pubic bone at the front to the coccyx, so our tailbone at the back. And then it kind of goes side to side between our sit bones. It's quite big. It's like a bowl. And it holds all of our pelvic organs up inside. Now, obviously, we need holes in the pelvic floor for our rectum, our vagina, and our urethra. So those are holes that are in the pelvic floor, and they have the ability to sort of, for those to come through. So, okay. Let me just move this on. So you can see that a little bit more closely. Now you'll also notice as part of the pelvic floor, there's some muscles up at the back of the pelvis. Now these are muscles that are involved in the hip joint and how we laterally rotate our hips. So there's also a few other muscles that sort of sneak into this whole pelvic floor function that are involved. So it's a little bit bigger than you might realize. So I did a little bit of a look at the research around women who have a diagnosis of ovarian cancer, and the prevalence of, we'll call them pelvic floor disorders. So PFD is a pelvic floor dysfunction or a pelvic floor disorder, i.e. some kind of problem with the function of the way in which your pelvic floor is working. So you might have some symptoms of urinary incontinence or some kind of prolapse or some issues, okay? So the 2 papers that I looked at, we sort of had a little bit, they had a look at lots and lots of research, and basically, around 50% of women generally have some kind of urinary incontinence. Now, this increases after menopause and obviously in women who've had children, but there doesn't seem to be a particularly big difference in women who've had a diagnosis of ovarian cancer versus the general population, which did actually surprise me a little bit. What is quite interesting, though, is the paper on the right-hand side shows that women who have a diagnosis of ovarian cancer also have quite a high prevalence of some kind of sexual dysfunction. That's perhaps not at all surprising. So we're looking at sort of 62 to 75% of women have some issues around intimacy around the pelvic floor area. So that's something to really be aware of, because that's really important for our quality of life. But all that being said, 50% of women having some kind of urinary incontinence is not a good thing. So what does the pelvic floor do? So first of all, it supports the organs. So it's this bowl, it holds everything up. It has a sphincteric action. So that basically means it is responsible for continence. So it helps us allow the contents of our bowel and our bladder, so we can hold on when we need a wee or when we need to go to the toilet. In terms of sexual function, the pelvic floor needs to be able to relax to allow for penetration and contract for orgasm. So it has a really important role there. So sometimes women will say they experience pain during intercourse or struggling to achieve orgasm, and those can often be related to issues with the pelvic floor and how that's functioning. And it's involved in stability generally throughout the body. So in terms of the way we hold, our posture, our pelvic and trunk stability. So it has a number of different roles in the body. The optimal function of it needs to have good resting tone. So when we're just moving around our normal daily lives, we're not aware of it. And it doesn't want to be too tight. So it just needs to be a relaxed muscle that works for us when we need it to, and it needs to be relaxed when we're just sitting around doing nothing. We need to be able to allow it to relax for urination, defecation, and penetration. So, I mean, younger women, if you need to insert a tampon or for sex, we need to obviously have that relaxation, but also just to be able to urinate and defecate normally. It needs to contract for orgasm, but it also needs to contract subconsciously when the body needs it. So if we go and lift something heavy, or we cough, or we laugh, or we sneeze, and we feel that leakage of urine, that's a sign that the pelvic floor is perhaps not quite working in the way it should be. So it's not contracting subconsciously when we need it to. It needs to have correct alignment with the diaphragm. So we sometimes talk about the pelvic floor being like the second diaphragm. I'll come on to that in a moment because that's a really important point. And the pelvic floor needs to have correct timing and coordination with other abdominal muscles in the core. So if any of you have had any pelvic floor physiotherapy, the physical therapist will often be talking about how to get this timing and coordination of all the muscles to work together. Now, what we see after surgery, particularly abdominal surgery and any surgery involving the pelvis, now that's necessarily, the surgery hasn't been done to the pelvic floor itself, but because you've had surgery to the abdomen, what often happens is there's a real kind of loss of coordination and timing within that muscle group. So I think that's a little bit skewed, and we don't feel like those muscles belong to us anymore. So we need to retrain that process of getting those muscles to work together. So we need to have awareness of the pelvic floor. We need to know how to be able to contract it and how we can feel, we need to be able to sort of locate it and find it. And for a lot of women, that can be really quite challenging. We also need to be able to get it stronger, so it actually does everything we need it to do. But we also need to be able to consciously relax it. So we can feel it, we're aware of it, but we can also allow it to relax. Because if we're holding too much tension in there, we can get what's called a hypotonic pelvic floor, where it's weak, but it's tight. And I think we see quite a lot of that in women with a cancer diagnosis, because there's a lot of anxiety, there's a lot of stress, there's a lot of tension in the body generally, and that tension often gets transferred into the pelvic floor. And we need to have good alignment. So this concept of the pelvic floor being the second diaphragm. So we're talking about pelvic floor dysfunction, when something has gone a bit awry with the pelvic floor and the way it's working. There's kind of 3 areas really, or 4 areas. We've got urinary incontinence. So that's when you leak, when you jump, laugh, sneeze, cough. But it also can be what's called urge urinary incontinence. So if you need to rush to the toilet and you don't get there in time, you can't hold it, that's urge incontinence, slightly different to stress incontinence. So fecal incontinence is when you can't hold a bowel movement. Pelvic organ prolapse is where the vagina typically starts to kind of protrude out and it starts to sort of fall down because there's just not that structure internally to hold it in place. But it can also be 2 things called a cystocele and a rectocele. And this is where either the bladder or the bowel sort of push into the vaginal wall. I'll talk a little bit more about that in a moment. And then any kind of pelvic pain. So typically we're talking about chronic pelvic pain, which is there sort of all the time, maybe pain around the pelvis, pain in the vagina, pain around the rectum, you know, pain that's been, you've not had a diagnosis of anything else, and it's just this kind of chronic non-specific pain deep in the pelvis. So symptoms of some kind of pelvic floor dysfunction or disorder are acute or typically more chronic pain in the pelvis area. Leakage of urine or feces, and that can be stress or urge, i.e. you leak when you jump or cough, or you can't hold it when you need to go to the toilet. Some kind of unusual change to the bladder function. So some women talk about maybe they have like a split stream when they're urinating or spraying. Men will often talk about like a secondary dribble. You don't feel like you're completely emptying your bladder, sort of some change around the bladder. A heavy feeling in the vagina, or a feeling of a lump around the vagina where something feels like it's protruding out. Some bowel symptoms. Now, this can be constipation as well, because if the pelvic floor is too tight, we can't relax enough to go to the toilet. So we can end up with constipation and a discomfort during sexual intercourse in women. Now, what's really interesting, I've been doing a really deep dive into this, and what I've discovered is I've got the beginnings of a prolapse, which I didn't know that I had. Prolapses can be quite insidious. They aren't really very symptomatic, but they can kind of come and go a little bit intermittently throughout the month as well. I'm at menopause now. I've had 5 abdominal surgeries. I've delivered a 10-pound baby a long time ago, but I've discovered that I've got a little bit at the start of a prolapse. So I'm really now becoming super aware of that. So I think it's important to look at all of these symptoms and not just assume that it's just about leaking when we jump or cough or sneeze, because it's so much more than that. So there are 2 types of tone in the pelvic floor. We can have high tone and low tone. So you may have heard the concept of a Kegel, and a Kegel is an exercise where we squeeze the pelvic floor and we lift. So we want to squeeze that pelvic floor, recruit those muscles and squeeze and lift up inside. And we're typically given this as an exercise after we've had children to try and strengthen that pelvic floor. That's fine. But we also need it to relax. So what can often happen is the pelvic floor can have too much tone. It can be stressed, it can be tight, it can be holding too much tension. And the pelvic floor, remember, needs to be able to relax as much as it needs to be able to contract. So it's really important to understand the differences between the 2 types, because they have a different treatment pathway and a different focus when we're exercising. So if you have a high tone pelvic floor, this is what's called a hypotonic pelvic floor, and it's where the muscles are a bit too tight, but they're also weak because they're being held in like a tension all the time. Symptoms of this are pain, and maybe radiating pain into the inner thighs or up into your bottom, painful intercourse, strong frequent need to urinate, burning when you urinate, and that's different to having a UTI, so making sure that that's not the issue and that there's some other maybe repetitive burning going on. A kind of feeling of burning in the vagina, and if in women who are menstruating, painful periods, and difficulty with defecation and constipation. It's that feeling that everything's really tight. Low tone, and this is more typical in most women, but you can see the symptoms here: leaking urine when you cough, sneeze, that's stress incontinence, failing to reach the toilet in time, urge incontinence, passing wind when you bend over from the rectum or even the vagina, when you get that kind of like sort of loose feeling in the vagina, and any kind of reduced sensation. And this kind of feeling of a bulge at the vaginal opening, heaviness in the vagina, and a dragging feeling in the back of pelvis. So anyone who comes to my classes will remember sometimes when I'm talking about exercises and we're moving, I'll say, if you're feeling any pressure or heaviness through your pelvic floor in your vagina, I want you to adapt this particular exercise or do it in a slightly different way. And that's why. Because if you're feeling that sensation, it just means there's too much load going through your pelvic floor for that particular exercise. But we also need to think beyond the pelvic floor. So the pelvic floor is part of us. We need to take a whole body approach. So yes, we need to do our squeezes and our particular exercises. For some people, that might be more relaxation than it is squeezing. We need to integrate pelvic floor exercises into other movements. So in class, I'll be teaching a calf raise and we'll be squeezing the pelvic floor. We'll be doing things with our legs apart. Exercise which integrate that pelvic floor into the whole body, because it needs to work when we're moving around. Think about the pelvic floor, and then we need to think about extending it out. So what's happening in our hips, our muscles, our glute muscles, and our shoulders? How are we aligning everything up? But we also need to take a whole body approach to strength, relaxing and stretching the muscles. Sleep and stress are also implicated in pelvic floor disorders, and hydration and hormones. So HRT is a really important consideration. And in women who've had ovarian cancer, it's not contraindicated, but it is important to speak to your own doctor about your own individual needs. However, the weakness in the pelvic floor and the muscles becoming weak can be improved by having HRT, because loss of estrogen impacts the way that muscles work. So muscles become weaker, tendons become weaker. We lose that kind of robustness of the connective tissue when we lose estrogen. So if you're struggling with pelvic floor issues, it might be a consideration to think about HRT as part of that. And hydration, because that helps us defecate better and more effectively. And we don't want to be not drinking because you're scared of needing to go to the toilet. So this concept of alignment and the pelvic floor being like the second diaphragm. So the picture on the far left is basically what we're going to be looking at. That is really good optimal alignment. So we've got the pelvic floor and the diaphragm sitting on top of each other, like a top and bottom of a can. I talk about this in class all the time. So we think about stacking our rib cage over our pelvis, like this lovely alignment. And you can see if we're holding our body in a different way, or our body's being pulled into different positions, that's not happening. And so they're not getting that recoil action like a pump that are working well together. So it's really important to try and work on our body to improve our alignment. Now, I'm not saying just stand up straight, because that's not the answer. We need to strengthen the body in the right way through correct Pilates classes and exercise to make sure we've got that lovely posture that comes from the right exercise. This is not just stand up straight instruction. We need to work the body so we achieve that lovely optimal alignment. So let me show you how the body works when we're breathing. So if you're a regular in my class, you know what I'm talking about, because I teach this all the time. But when we breathe, we need to get the diaphragm and the pelvic floor to work together, and we need to get the deep core muscles to work together. So I'm going to show you how this all works. I'm hoping it's going to work, because it was a bit glitchy the other day. There we go. Okay, so you can see here, hopefully that's moving. When we inhale and when we exhale, what happens to the body? So as we inhale, the diaphragm moves down and the pelvic floor moves down. As we exhale, everything comes back up and contracts. So we inhale. Now this is correct timing, correct coordination, and correct pressure management of the abdominal and thoracic cavities. So we inhale and we expand. We exhale and everything comes back in. Now this is happening at rest all the time, okay? But we're going to practice this in a conscious way in a moment. So you can see here the diaphragm is this huge big muscle. As we inhale, it presses down and then it recoils back up on exhale. And then we've got this muscle, which is like a wraparound muscle called the transverse abdominis. This is our deepest core muscle. Imagine like the center of the onion. So there's some layers of connective tissue, some fascia, and this big muscle, and it works like a label that wraps around. And then you can see here the group of pelvic floor muscles. As we inhale, that bowl lowers down. As we exhale, it comes back up. So we need to become conscious and aware of what's happening with this breath. And then it's all going to come back together. And we're going to practice this in a moment. So this is our pressure management system. but it's also good coordination of all of the muscles. What happens after surgery is that gets a bit skew-whiff because we've had trauma to the abdominal wall, we've had a lot of extensive surgery, we've had pain, and the coordination, the timing just gets skewed and nothing then is working correctly. So we have to retrain that. Okay, what we've got here is a little device. I think it's called a PeriFit, this one. And there's lots of different devices on the market, lots of different things you can use to try and help with your pelvic floor. And it depends whether you need to increase tone or you need to decrease tone. So remember those two high tone, low tone symptoms. You've got to be sure that you need to do lots of squeezing or you need to relax, because there's different ways to train. So we don't just want to go down the route of we need to squeeze, squeeze, squeeze and strengthen, strengthen, strengthen. There is more to it. It's more nuanced than that. So there are lots of things out there like this. And this is obviously a device you insert. It attaches Bluetooth to your phone, and then you sit and play like a computer game with it squeezing away, and this ball bounces up and down. It can be really useful, and it can get you some lovely feedback on how everything's working. There are all sorts of other devices. There's weights, there's pelvic floor toners and squeezers, all sorts of things. Some things are available on prescription. But before you go rushing down that route, if you feel like there's some light bulbs going off today and you're thinking, I think I might have a bit more of an issue than I realized, the first port of call is your GP, or you can self-refer to a pelvic health physiotherapist who will be able to do an internal examination and feel what muscles you're recruiting and whether you've got the correct timing of that. Because it's really important to know whether you're high tone or low tone before you start rushing down a squeezing kind of regime, if that makes sense. Or if you feel like your squeezes aren't working and you've been doing them a while, then that's another indication to go and see someone. So it really, anyone who's got a gynae cancer and has had abdominal surgery should be referred to a pelvic physiotherapist, but that's probably unlikely to happen. So you need to initiate that yourself if you feel you've got some issues going on. There are other things you can get. So these things here, oh, you can't really see them very well. I'll show you in a second. The little weights. So you put that inside, and there's different weights. And you can sort of squeeze them in and hold them in and do the ironing with them in. And that's a way of kind of really making sure that you're like, oh, okay, this is quite heavy. I'm not as strong as I thought I was. So that can be quite useful as well. But get probably an assessment first, or kind of check in with your GP. Right. So what can you do? Get an assessment, get some advice, see a pelvic health physiotherapist. There are medications that can help with urinary symptoms. It might be thought of having HRT. And there's something called a pessary. And a pessary isn't just something that dissolves internally. It's a device that goes inside the vagina, and it kind of creates support, like a scaffolding on the inside. Now, a pelvic floor physiotherapist fits those, some GPs do, and that can be helpful for prolapses, particularly that rectocele and cystocele type, the ones that push where the bowel and the bladder are collapsing into the vagina. Explore some books and resources, do some reading, do some research. There are some fantastic books out there. Have a look at the different trainers and toners and different things that are available. The NHS Squeezy app is great. The kind of issue is that people just probably don't do enough of it, or they're not doing it in the right way. Think about a whole body approach to the pelvic floor problem. So it's not just about squeezing. It's about squeezing and integrating that pelvic floor into other things, which is why Pilates is brilliant if it's done in the right way. And we don't want to be feeling like we're overloading the pelvic floor too much. So if you're feeling like you're getting symptoms, think about the things that you're doing if you're doing very heavy lifting or you're doing a lot of running. It might be that, okay, we need to modify some of those activities, or do a little bit more work on the pelvic floor in an integrated approach. If you feel like you've got a very hypotonic pelvic floor, so that very high tone, that kind of clenched stress type of pelvic floor situation going on. Sort of maybe some talking therapy, some EMDR, which is like a sort of trauma therapy, meditation, really focusing on your sleep. So not just tackling it from a squeeze and exercise perspective, but tackling it from a allowing your body to relax perspective. Because in women who've had a cancer diagnosis, there's a lot of anxiety and stress going on. So that's super, super important to kind of, you know, think about the different ways that your pelvic floor is responding to the stress that you're under. And then hydration and nutrition. So fluids, having lots of fiber, so your bowel function is good, avoiding constipation. And I've thrown weight management in here as a bit of a sidebar, but it is obviously if you are becoming heavier, then there's obviously more pressure through the pelvic floor. So I know it's not easy and there's loads of other things going on, and weight management is probably the least of your worries when you're dealing with an ovarian cancer diagnosis. But if there is a way to manage weight, and it's just being aware of that is another risk factor for placing pressure on the pelvic floor. Okay, so let's have a little practice. We're going to do some practical things. You don't have to join in. You can just sit and watch if you want to. If you are less than 6 weeks post-surgery, then maybe just sit and watch. Most of it actually is fine, and you'll be absolutely safe to do it. We just put that caveat in just to make sure. Yeah, just sit and watch or join in. I'm just going to demonstrate a few things, and you can always come back and watch this section of the video again and kind of practice a few techniques. So the first thing we're going to do is see if we can actually recruit our pelvic floor and just bring a bit of awareness to it. We're going to think about our alignment and what that feels like and looks like. We're going to practice some breathing. And then we're going to add a few integrated exercises standing up and on the floor on the mat. So let's just start by trying to see if we can recruit our pelvic floor, and I'm going to teach you what a good contraction should be like. So I'm just going to move and sit on a box here, so hopefully you can see me. So I don't need to see you. I'm going to just drop my screen off as well here as well. Hold on. Okay, right. Cool. Okay, so I'm going to sit nice and tall. I'm going to think about that alignment of the pelvic floor and the diaphragm. So making sure that they're kind of lined up on top of each other. And we're sitting tall in a chair. So I'm sort of on my sit bones. But we really need to focus on relaxing the legs, relaxing the bottom, relaxing the shoulders. And we're going to close our eyes and we're going to visualize that sling of pelvic floor, that bowl at the bottom of our body. And we're going to take an inhale, like in the video, just let everything relax. So feel your breath go into your belly and your pelvic floor. And then exhale and squeeze your pelvic floor closed and lift it up inside. Hold it for 3, 2, 1. And then let it go. It's really important to completely relax and let it go. So let's try that again. Take a breath in. As we exhale, we are squeezing the pelvic floor closed, lifting up inside, and hold. Now check everything's relaxed. Legs, shoulders, bottom muscles. 3, 2, 1. And let it go. So sometimes I describe it like, imagine one of those boxes of tissues, those square boxes of tissues that has a tissue poking out of the top. Imagine that you're going to use your vagina, bear with me, but it's a really good analogy. You're going to use your vagina to grab a tissue and pull the tissue out of the box. So you're kind of getting that feeling of grabbing and pulling up and into, up and in into the vagina, okay? That's kind of that feeling that we're looking for. This is not just a stop yourself having a wee. We need to recruit the whole bucket of the pelvic floor. So let's take that another breath in. Everything's relaxed. And then exhale. Grab your tissue, draw it up inside. Now really pull it out of the box. Pull it up inside, but relax everything else in the body and hold for 3, 2, 1. Relax, drop the tissue, let it go. Hopefully that little visualization really works for you. But you can try something different that works. You can visualize different things. Let's go one more time. And this time we're going to hold it for longer. And I want you to see if you can continue to do normal breathing when we've got the contraction on. Okay, so we take a breath in. Exhale. Squeeze, pull up inside, pull your tissue up. Now hold. Now just do a few breaths, two or three breaths. So we can contract and we can breathe. And then relax and let it go. That's a little bit trickier. Now, there are a million different ways to do pelvic floor contractions, and you'll see some people talking about doing like elevators where we're going squeeze and lifting higher and then lowering back down. Personally, I feel like that's too complicated. We need to keep it as simple as possible because that will enable us to do it more frequently. So let's go now for a little bit longer and we'll see if we can hold a 10-second contraction. So nice and relaxed. Remember your stack. Take a breath in. The breath is down into the bottom of the pelvis. Breathe out. Squeeze, pull your tissue in. Now lift and hold. Let's see if we can go for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax, let it go, let that pelvic floor go. Good stuff. So a 10-second hold.
No, it's fine.
A 10-second hold is quite a long hold. Okay.
That she's talking about is vocation. It's more just about
This lady on me. There we go. Right. So a 10-second hold is quite a long hold. Okay. So if you find that 3 seconds or 5 seconds is your limit, that's where you stay and you work on repetitions there. So we want to be doing the gold standard is a 10-second hold 10 times with a 10-second recovery in between each one. Okay. So we've got 10-second squeeze, 10-second recovery, 10 times. That's what we need to work towards. So if you're using the NHS Squeezy app, you can add that in. Now, I was talking earlier about these little weights. So you can then put one of these little weights internally and hold it in, and that will give you a little bit of feedback. And there's different weights of different weights. There's light ones and heavy ones. This is a product called Bodyotics, which I have literally just got, and I'm just trying it out. So I'm not, I don't know. Let's see how it works. Got lots of good reviews. There's lots of different things like that, but they're basically just weights. So you have to hold them inside. And if they fall out, then you've kind of got a bit of an issue going on, because that's actually really good feedback. So you can do your pelvic floor squeezes using a device like that, which helps just give you that little bit more feedback. And also it makes you do it a bit more because you put it in and you realize you've got to do it. Okay, so we want those long endurance squeezes. So about 70% of the pelvic floor muscles are made of what we call slow twitch muscles, endurance muscles. So we need to focus on our long squeezes. We do also, though, need to do some quick squeezes. And these can be quite useful for people who have urge incontinence versus stress incontinence. So let's do quick squeezes. So this time we just squeeze up, relax, squeeze up, relax. So you're really pulling the tissue out quickly and then letting it go. Up, up, this kind of feeling, okay? So let's do 10 of those. So get your alignment, nice and relaxed. Okay, let's go. So squeeze, relax, squeeze, relax, squeeze, squeeze, squeeze. Make sure you're relaxing between each one. Squeeze, 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 squeeze. 2 more. And then relax. Good. So daily practice should be a set of 10 quick squeezes and a set of 10 times 10 long squeezes, or whatever you can manage. So you can modify that and work up to that. And ideally, probably twice a day. But this is why often people say pelvic floor exercises don't really work or Kegels don't work, because it's quite a commitment to do it. So using a device like the weights or the pelvic toner can be a little bit more, make things come along a little bit quicker. So I do think there's probably room for that. However, if you're thinking, well, I can squeeze, but I'm not sure I'm relaxing very much, or I feel like there's a lot of tension there, or I've got signs of that high tone pelvic floor, then you probably want to be thinking about relaxing it as well. Okay, if you have got a Pilates ball, one of these fellas, and not everybody has, but if you wanted to get one, I use them in class all the time anyway. And if you want to get one and practice this again, take some air out of it and let it go to like it's practically deflated. There's just a little bit of air, and we're going to sit on it. So we're going to pop it underneath there, and we're actually going to see if we can bring a little bit of awareness to the pelvic floor. So bear with me. You don't want to stay here too long because it's a little bit uncomfortable. But I want you to imagine that that ball is a strawberry. Okay, and you know when you melt chocolate over the top of the strawberry, it just kind of runs over the top and creates this lovely kind of relaxed top. That's what we're aiming for here. I want you to visualize your pelvic floor just melting over the top of the ball. So this is an exercise to bring awareness to the pelvic floor, to give ourselves a little bit of feedback about where it is and what it's doing, but also to let us relax it. So we're not just rolling around on it and tensing. I actually want you to, we're going to melt over this ball. Okay, so we're going to take just a lovely breath in. And as we breathe in, we're just going to let it go. Let everything melt. And then relax and breathe out, but don't contract this time. We're just focusing on letting everything melt over the top of it. Take a breath in. Feeling that, just that chocolate melt over the top of the strawberry. Relax. So we're just letting everything go. You feel your belly become a bit softer and that pelvic floor relax. We'll go one more time. Just let everything go. And you're kind of fighting because what you want to do is squeeze and pull off the ball, but let everything just melt into it. Now we're going to try a few contractions here as well. So you might just feel a bit different to how we did when we were sitting just on the chair. So this time we're going to take that inhale and let everything relax, and we're going to do a contraction. So take a breath in. Now we're going to lift off the ball, squeeze up, pull up off the ball and lift up and away, pulling that tissue up inside, and then relax and let the chocolate melt over the top of the ball. And then you can do that, you can practice that a couple of times, but we don't want to be here too long. Okay, so that's another tool in the toolkit to bring awareness to it and to start to try and hunt out whether you've got a bit of a high tone or a bit of a low tone. It can start to give you some clues. Bring a bit more feedback and focus into the pelvic floor if you're struggling to find it. Okay, so the next thing is an exercise that you're going to think has got nothing to do with the pelvic floor. We're going to do some rotational work into the spine, because think about the diaphragm needs to sit over the top of the pelvic floor. We need to get good alignment. If that's not in place, if the diaphragm's sitting like this or like this, it's not aligned. Now, the way the ribs sit is really important. This is a whole body approach. So we're going to do some thoracic rotations really gently. Think about stacking the ribs over the top of the pelvis. Bring our thumbs up to our shoulders. Let our elbows just sit and rest. Now we're going to keep our hips fixed, and we're going to create a little rotation into the upper body. So let your head go with you. So we just rotate round and round. So it's going to feel really stiff and sticky. Try to get the movement to come from your rib cage, not your shoulders. So the movement is coming through the ribs. You're twisting like a corkscrew, just nice and gently. Now, as you start to warm up, you'll feel you can go a little bit more. Let's do a couple more. And then rest and relax, drop the shoulders. So getting those ribs to move, getting that rotation into the body can help set the diaphragm up for success, and it becomes better aligned over the top of the pelvis. Okay, so I do that in class as well. That's another one of the things we do. It's this whole body approach to rehab. Okay, so now we've got the ribs moving a little bit. Let's see what we're doing with our breath. Hands on our rib cage. Now, remember the video that I showed you, that anatomy. Think about, as we breathe in, what's happening. The ribs are opening, the belly's expanding, the pelvic floor is dropping down. So visualize that. Close your eyes, hands on your ribs. Take a nice breath in. Feel the ribs open like an umbrella. Feel your belly move out. Exhale and feel the rib cage come down. But you also want your belly to pull in. Don't keep exhaling so far that your belly then pops out. Okay, so take a nice breath in. Inhale, ribs open wide. Belly is open. Exhale, ribs down, and think about pulling the abdominals in as well. So now we're going from resting breath to now conscious, intentional breathing practice. Okay, let's try again. Big breath in. Exhale, ribs down, and consciously pull the abdominals in. Go one more time. Breath in. Exhale, ribs down. Belly comes in, pelvic floor comes up as well. So we're kind of getting that lovely engagement. Everything's working together. And then relax and let everything go. So this is now around our timing and coordination of the diaphragm, the breathing muscles, the abdominal muscles, and the pelvic floor. This can take quite a lot of practice. So if this is feeling really difficult, don't worry. It's a really tricky one to get, okay? Right, so let's see how we're doing on time. We're going to try one more thing, and we're going to try a little bit of work in standing, and then we're going to have some questions. So I'm going to move back, and hopefully you'll be able to see me. Okay, hold on a second. Just give you my head as well. Okay, cool. Right, so we're just going to now practice all of that again in standing. So if we think about now what's happening, we've added a lot more gravity to the pelvic floor because we're standing up. So this is now more challenging to do our pelvic floor contractions in a standing position. So stand with your feet a little bit wide, so just hip distance, also just under your shoulders. And I want you to visualize that pelvic floor again. Just stand nice and relaxed. Put your hands on your bottom. So I don't want you to feel anything change in your bottom muscles. If you feel like you're clenching, you're using accessory muscles, the wrong muscles, and we need to focus just on the pelvic floor. So let's just go back to a standard pelvic floor contraction. Hands on our bottom. Take a breath in. Exhale. Feel the pelvic floor squeeze. You're going to squeeze that tissue, pull it up inside and hold. Now, you might feel a little bit in your tummy. You might feel a little bit in your lower back. That's kind of okay. We've recruited some core. But we don't squeeze the bum. 3, 2, 1. Let it go and relax. Good. Bit more challenging in standing, right? So if you were using those weights internally, you've got one inserted and you can now make it more challenging by standing up. Let's try that again. Get your ribs over your pelvis, good alignment. Hands on your bottom if you want, or you can take them away if you know you're not cheating. Breath in. Soft tummy. Breath out. Squeeze, lift and hold. Pull that pelvic floor up inside. A little bit of abdominal contraction, maybe a little bit in your back. That's all good. Hold. And then let it go. Completely relax. Good. Check you're not tensing with your legs as well. Okay, now let's see if we can do that standing on one leg. This is now getting more and more difficult, okay? So if you're struggling with the seated ones, these are probably not for you. So just practice with both feet. Let's stand on one leg and see if we can get that contraction, okay? So take a breath in. Exhale. Squeeze and lift. Now that is much, much harder just to get that sensation. Bring that on inside internally and hold. 3, 2, 1. Relax, let it go. Change legs. Just lift the other knee off the foot off the floor. Stand on one leg. Take a breath in. Exhale. Squeeze the tissue, lift and hold internally. Squeeze, squeeze, squeeze. 3, 2, 1. Relax and let it go. So they are much, much harder to feel like you can recruit But now what we're doing is integrating the pelvic floor into some movement. Okay, so this is getting quite advanced. Okay, right. Let's have a look at some questions. So I've given you lots and lots of information. I've given you a few tasters, a few ideas, a few things to practice, and hopefully highlighting the differences between this kind of tight pelvic floor and this kind of ability that we need to kind of a weak pelvic floor, a loose pelvic floor. If you have a hypertonic pelvic floor and you're tight, other things that you can do, I'll just demo a couple of things actually. Other things you can do to kind of relax the bottom area, relax the glutes, relax your inner thigh, is something called a puppy pose, which is like a child pose, but slightly different. So we do this in class. So we stick our bottom in the air and we just come down into this position. Head is on the floor, bum is in the air, and we've got some stretch in the pelvic floor, and we're just kind of letting it go and relaxing. So we're not really doing anything here apart from getting into position and allowing it to relax. So the bottom is kind of tucked, and the tailbone is lifting to the ceiling. So that's our puppy pose. And then we can do a kind of modified happy baby on our back. So we can come onto our back, and we're going to go really wide with our knees, and we just kind of rock and just rock and roll around and let it go. So you can see the intention here. We've got our knees wide, we've got our pelvic floor sort of with a little bit of stretch, but we're just moving and allowing it to relax. Okay. So it's not all about squeezing and contracting. We've got to take a wider, full body, relax and contract approach to good pelvic floor function. If you feel like any of this today has kind of either consolidated some thoughts that you have got an issue, then it's probably time to get a referral and get some help, or start to experiment a little bit yourself and start to work with some tools and some contractions. And if you think, you know, you feel like you're weak and you've got some signs and symptoms, and you can sort of start to work on a few things. So yeah, start to kind of explore your body, explore some ideas, and yeah, don't be afraid to go and ask for some help and get some advice. But there's a ton of really good books out there as well. So yeah, hopefully that's been helpful. Right, I'm going to have a look at some questions. I'm going to answer these anonymously. So people will, if you want to put something in the chat box, then please do, but I won't say your name because we are still recording. I'm going to have a little look. Oh, there's lots of questions. Hopefully I'll be able to answer them. Okay, right. Okay, so someone's saying, I've not been able to wee straight since having internal radiotherapy. Is this fixable via pelvic floor? It really depends on the impact that the radiotherapy has had and where it was. If you've got a kind of pelvic radiotherapy issue going on, then that is definitely a place for a pelvic floor physiotherapist to have some intervention. So I think that's super, super important. If you've had radiotherapy as well, and you've got symptoms, then there's another indication there to get some help. You may be able to make some improvement with a little bit more exercise, with the right type of exercise, but it's really important to get some help with the pelvic floor physio. Okay, I'm expecting to have a large abdominal reconstruction for a large incisional hernia and mesh from hip to breastbone to be inserted. How will this impact? Surgeons don't know. Okay, so if you're having an abdominal reconstruction with mesh through the front, you will still have some muscles there. Okay, you're not just being replaced with mesh in the front. The mesh is another layer of muscle. There are other muscles still involved. So it's not like all the muscles gone and you're just a layer of mesh at the front. So you will still have muscles, and your core and your pelvic floor are all still going to be needing to work together. So you do need to get a bit of timing and a bit of coordination for everything to start to work together. Okay, so again, see a pelvic floor physiotherapist, get them to do an internal examination so you can see if those muscles are working correctly. And you still need to do some rehab. So by that, I mean really gentle things like pelvic tilts early on, kind of little bridges, leg slides, so starting to get the abdominal muscles to work together and really think about your posture and alignment right from the very, very start, okay? So yeah, it's really important to get that put in place. Any considerations to be cognizant of for a couple of incisional hernias? Okay, so everything I've talked about today, when we're talking about pressure and we're talking about timing and coordination, if anyone has hernias, then hernias are a result of pressure on the inside of the abdomen going to somewhere it doesn't need to go. So pressure is going to go the path of least resistance. It's going to follow the line of where there's an incision, or if you have a stoma, where the stoma is, or it's going to go through the pelvic floor where there's weaknesses. So hernias are really an indication of pressure mismanagement. So let me just go back to that question. Okay. What I'd say is, if you have got some incisional hernias, then the last thing you want to do is avoid exercising. Exercising in the right way is really important. So the classes that we do, and I think you come to the classes that we do, I would say are safe and appropriate, and it's that level of exercise. But I would also say add in some additional core and pelvic floor exercises. Don't be scared of exercising your abdominal wall, because we need to get those muscles to get the right timing, the right coordination, and put some strength back into them, but in the right way. Don't suddenly go and start doing planks and crunches. We need to do the right type of exercise. So clinical Pilates, the sort of stuff I do in class, and just being aware of that coordination and timing of the core, because that's going to help your pressure management. To clearly identify pelvic floor. Okay, so someone's asking here about scar tissue. And I'm wondering whether that's scar tissue on the abdominal wall, or scar tissue somewhere in the pelvis, or scar tissue internally. Is scar tissue the only culprit, and do you need evidence? Okay, so, and she's also going to say, I'm now very aware there's a lot of tight tension in my lower abdomen muscles just above the pubic bone. Okay, so scar tissue and history of incisions is probably going to be quite tied with this hypotonic pelvic floor, a lot of tension, a lot of tightness. And I have no evidence for this, but I'd say that a lot of women who've had a gynae cancer are going to probably be presenting with a hypotonic pelvic floor, that tight, weak pelvic floor. So scar tissue is not it's just not the only culprit. We've got coordination, we've got timing, we've got alignment, we've got endurance, we've got strength of the muscles. There's a whole bunch of stuff going on. We can't just say, well, you've got scar tissue, go away, that's your only problem. You know, that's a nice answer, but I think we need to have a little bit more empowerment and feel like there's some things we can do. So there are also specialists who specialize in scar tissue massage release. So that might be something to investigate, particularly if it's just on the abdominal wall. There are specialist cancer scar massage therapists out there. You might be able to find someone like that who can help you to release the scar tissue of the abdominal wall itself, because it's all about trying to get this alignment back and get coordination and get all the muscles working together. Okay, but if you've become aware of tightness from this, then I would say that that's something to work on. So kind of go down that route rather than the squeeze, squeeze, squeeze route. Can it be both high and low tone? I think it's probably one or the other, but certainly in terms of what you need to do and where you need to prioritize your work, if you've identified you've got symptoms that sit in one category more than the other, then focus more on the relaxation and really make sure that you've got the ability to relax and let the muscles go as well as contract. So sometimes if women go and see a pelvic floor physiotherapist, they'll come back and they'll say they've stopped me from doing Kegels and squeezes because they want me to just allow it to relax. So they'll come back with a stretch or a, you know, happy baby pose on their back, when actually they've been doing squeezes, but because the squeezes haven't been right, it's made things worse. So if you're not sure, go and get an assessment. If you feel like you are sure and you're like, actually, yeah, you're right, I'm feeling quite tight, focus more on the relaxation stuff and then start to focus on coordination. Once you've got it relaxed, you can bring in a little bit more strength later on. Okay, the diagram showing the breathing with the diaphragm lifts and folds is really helpful. Brilliant. Okay, so we made that when I was doing some training for some nurses in China, and we needed to create something that was working. That was working for kind of a non-English speaking audience, and it's worked brilliantly. So now I use it with everyone because it's just perfect. You can visualize it. You can understand how the breath and the timing of everything all works together. Okay, someone says, I feel like I've got a high tone pelvic floor. I found it difficult not to use other muscles like legs. Is this just a case of regular practice? Yeah. So things like sitting on the ball can bring a little bit more awareness to the pelvic floor. You can just kind of get a bit more feedback. Using things like the weights, you can put them internally, you can feel them, you can get a little bit more feedback that way. Don't try too hard. Okay, so if you feel like you're tensing and squeezing, just relax a little bit, just get a tiny contraction, let it go. Let it go. Just practice, practice, practice. Try in the bath as well. So if you lay in the bath, you can insert a finger into your vagina or just around the edges, and you can feel the muscles and just get a little bit more contraction. But don't go too hard to start with. Would the internal examination I get at the gynae checkups include looking for signs of prolapse? Potentially, but not always. You know, I don't know necessarily what they're looking for or what they're feeling for, but not always. And actually, sometimes prolapse are only evident when you're standing up. So I would be, if you feel like you might have a bit of prolapse, maybe try in the shower. If you're standing in the shower or you're standing up, have a feel and just see if you can feel a bit more of a bulge. Can you press it back in? Have you got any symptoms? A really close friend of mine has difficulty having a poo, and she finds she gets really constipated. Sometimes she'll go for days, and basically what's happening with her is her rectum is kind of falling into her vaginal wall, so the kind of poo is getting stuck in the and that's called a rectocele. So the rectum is kind of collapsed into the vaginal wall. So and sometimes those things come and go a little bit depending on what's in the bowel, but also whether you're standing or lying. So if you're lying on your back, your legs open, then they're not going to see an awful lot. When you're standing up, there's all that pressure and you can see a lot more. So for self-referral to a pelvic floor physio, how would you find a good practitioner? So if you go onto the NHS Squeezy app, there is a list of people on there that are registered. And there's also a organisation called, I think it's called POGP or POPG, and it's a pelvic obstetric and gynae physio organisation. They have a list on their website. Surgical scarring has been blamed for defecation problems. Can this be remedied by massage? I believe constipation caused hernias. Doctors laughed it off, but it's obvious. Yeah, I would agree. So constipation, if you think about straining, increasing pressure around the abdomen, you're increasing your risk of prolapsing, you're increasing your risk of abdominal hernias. So yeah, absolutely, constipation is definitely creating pressure and creating a risk of all those other issues. So one of the things is we need to be reducing the risk of constipation, trying to sort that out a little bit. In terms of scarring, I'm not sure where your scarring is. If it's on the abdominal wall, then it's potentially a massage therapist can help that, but it needs to be a specific scar massage therapist. But also internally, some physiotherapists will do some internal scar massage as well, which can be a little bit weird. I've never had it, but I've known people who have. when I'm getting pain, I find and sort of external support helps. Any guidance and I could check out supports just for women. I'm not sure. Are you talking about like an abdominal support, like a sort of belt or band or something? Because if that's what you're talking about, there are lots of products out there. So actually, just standard old leggings, you know, high-waisted leggings that create some support can be really comforting and helpful, but we don't want anything too tight, because if it's too tight, it's going to squash us too tightly around the middle, and then that's going to create more pressure up and down. It's like a squeeze a balloon in the middle, and the pressure bulges up and down. So we want to make sure that pressure is our priority. Pressure management is our priority. Ability to relax and contract the muscles. If you feel you need support around your tummy, it probably means you need to build your own internal support muscles a little bit more. So spend a bit more time working on some Pilates exercises, build those core muscles up a little bit more as well. If you're talking about support underneath, there are some shorts and some kind of products that kind of create like a sling. I'm not sure how effective they are, and they're very expensive. But in terms of abdominal support, just leggings, you know, good old sort of Sweaty Betty or whatever you can find that creates some abdominal support can be useful. There are other products out there which are mostly aimed at stoma people, but they can be used by anyone. There's a product called, a company called Vanilla Blush, and they create like vests and high-waisted pants. They can be quite nice, just some nice sort of compressive support around the tummy, but don't go for anything that's too tight. So we're looking for comfort, and we're looking for a feeling of confidence. We're not looking for a feeling of being squeezed and trussed up. Work on your muscles. That's your priority. Work on timing, coordination, breath, and then start to build the endurance into the muscles when all that is working. Okay, I think we are done. I've run over time a little bit. Hopefully that's been helpful. If you could just give any feedback to Ovacome, that would be amazing. I hope everyone has a lovely weekend. You've got lots of lovely things planned, really relaxing weekend. Thank you so much for joining me. I hope that's been useful, and yeah, take care of yourselves. See you soon. Bye.